Alive and Well is brought to you by Pine Rest Christian Mental Health Services.
September is National Suicide Prevention Month. Unfortunately, suicide has been on the increase over the past decade, and the COVID pandemic has increased calls to suicide hotlines. Dr. Yvonne Edwards from Pine Rest helped author a review article this spring on how the pandemic could increase suicide, but it also offered some hope. Welcome, Dr. Edwards. Good to have you here.
Thanks for having us.
So let's talk about COVID, and we clearly know that it has made life more stressful. Talk a little bit about the increase and maybe that connection to COVID.
So the pandemic has changed so many aspects of life. Things that used to be fairly straightforward, leaving the house, schooling, grocery shopping, that can be very stressful. And I think all of us can be feeling that stress. Stress is a big contributor to depression, anxiety. And when you layer on top of that things like social isolation, financial stress or unemployment, increases in grief and loss due to both the increase in death from COVID directly, but also indirect sources, lack of access to some of the supports and medical providers we're used to, things like primary care physicians and spiritual or religious leaders, and then just the general fear or uncertainty of not knowing what's going to happen with that. All of those things are risk factors for suicide, and on top of anxiety, depression, and they can also contribute to less healthy coping strategies. We see a lot of increase in alcohol and marijuana sales at the beginning of the pandemic. And unfortunately, what we know is about a quarter of those who die by suicide are acutely intoxicated at time of death.
Oh my.
So that's a huge risk factor for suicide in particular.
We know that some people are more at risk than others, right?
Absolutely. So there's groups that are normally at risk. So LGBTQ community, those individuals often have suicide risks that are several times that of the general population. And we worry about how the pandemic may uniquely be impacting them. That social support for those, for all of us, but especially for those within the LGBT community, is really crucial for being a protective factor against things like suicide. And the pandemic has isolated them as well as the rest of us.
Yeah.
That social isolation is also a big hitter and seems to have a larger impact on teens. So social isolation can increase their suicide risk about 2 times, which is particularly concerning because if you look at the data from the last decade, teens have a suicide rate that's increasing at a faster rate than we see for adults.
Yikes. So what can individuals do?
There's a lot of things that we can do, things from checking in with our loved ones. There can be this misperception or this myth that if you talk about suicide, it'll put that idea in somebody's mind.
Yeah.
And the research repeatedly shows that's not the case. So asking, how are you doing? How are you coping? They seem particularly down or really struggling. Ask the question, ask, have you thought about hurting yourself in some way? Do those thoughts ever come to mind? Because that's somewhat common when people are really struggling. Making sure we're taking care of ourselves and our loved ones. Things like getting out and exercising, connecting with people. There's some great apps that can help with that. But we also know the transmission of COVID-19 is lower outside. So get out, go for a walk, connect with people outdoors. And if you're struggling, please reach out early for mental health help. That therapists and psychiatrists can do a lot more if you reach out early on.
Talk a little bit about what Pine Rest is doing.
So Pine Rest is trying to ensure that we provide care that is effective and safe in multiple ways. And so we have a lot of teleservices available. We have teletherapy groups, we have teletherapy, individual therapy, psychiatry, all sorts of services. We also have our psychiatric urgent care center for adults, which you can walk in or you can call ahead.
Well, for folks who want to learn more about suicide prevention, you may do so on the Pine Rest website. We put a link to it at 13onyourside.com. Thanks so much, Dr. Edwards.
Thanks for having me.